Good morning, everyone. I am Philomena Robertson, Press Secretary. Welcome to this week's Post-Cabinet Press Briefing. This week, I have with me the Honorable Minister for Health, Honorable Nickolas Steele, and the Minister for Tourism and Civil Aviation, Honorable Clarice Modeste. They will be bringing us various updates from their respective ministries. Thank you so much to members of the media who have joined us this morning, and also to the listening and viewing public who have joined us via the various media platforms. Minister Steele, we'll get things started with you this morning. The floor is yours now to make an opening statement.
Thank you, Philomena. Good morning to you. Good morning to all of our viewers and listeners and my cabinet colleague, Minister Modeste. As of this morning, based on the one positive case that escaped from quarantine, we have 13 direct individuals and 17 indirect individuals that have been put in isolation/quarantine as a result. We will keep these individuals in quarantine and observation for at least 4 days before we test them to see if indeed they were exposed or infected by the individual. The other individuals from Friday night that caused a breach in quarantine, I am told by the Commissioner that they have been charged. So too is one other from Monday morning for attempting to breach protocol. We are, as we have said, following maximum enforcement with respect to quarantine. I just informed the nation that the charge for breaching quarantine is $10,000 EC dollars. That is the charge. And these individuals will have been charged, and anyone else who attempts or assists will be charged as well. Just to say that the individuals in the area of Tivoli, I know that that entire village neighborhood has been very uneasy. They are in our thoughts and prayers, in my thoughts and prayers as well. We continue to actively contact trace, and I want to thank individuals for calling in and giving information and asking questions too, where some persons were not sure or wanted to confirm if they were in the proximity of or in the relevant places. And this is what the teamwork that will keep us safe. And this is a prime example of that. I just want to stress that in many of the instances, if individuals were following the protocols as we had said, they would not be in quarantine. They would not be possibly exposed. If individuals were wearing their mask, if individuals were maintaining the safety distance, if individuals were not engaged in mass gatherings, we would not have this level of concern in the Tivoli area and nationally, nor would we have individuals, the number of individuals exposed or possibly exposed. So I think I want to reiterate, we have 3 levels of defense. The first level of defense is at our ports of entry in terms of the screening and the quarantining of individuals who come from other places where there is community spread of COVID-19. That is the first level of defense. Like any other system of keeping people confined to an area, maximum security prisons, for instance, anywhere, people, if they try hard enough, do get out. People escape from prison with all of the fences and security systems and bars that are put there. We rely on individuals recognizing the seriousness of this in order to maintain the law and follow the law. Same way we rely on individuals to recognize the seriousness of murder and of theft to not commit those crimes. We rely on individuals to be law-abiding, and that is our first level of defense. We put persons in facilities where we can observe them, where they can be observed, where they can be comfortable, but they are to respect the laws of the land. The second level of defense that we have is the contact tracing, which has been initiated and is working admirably. I wanted to commend the team that is working in the St. Andrews area in general, but in Tivoli specifically. That is our second level of defense, to contact trace, identify individuals who were or may have been exposed, and to isolate and observe and test when it is appropriate time-wise. The third level of defense, which is the most important level of defense, is us as a community following the protocols. Us as a community recognizing that people may breach level 1 and level 2, but that if we all maintain the safety protocols at level 3, we will protect the nation. So having said that, I turn over to my colleague, Minister, and then look forward to questions or comments from the media.
Minister, I think the floor has been turned over to you by your colleagues, so you may go right ahead.
Thank you, Madam Press Secretary, and thank you to my colleague. Maybe it might be permissible to remove the mask for a little while. I just following up on what Minister Steele said. It is so true, and I hope persons can, after hearing him, go back and seek to digest what the rationale, what he's saying makes so much sense. How we can protect ourselves. I am aware that there's a lot of concerns. People are concerned for their health. Some people are frightened, especially when we see what's happening in the world, and quite rightly so. But, you know, there are lines of defense, as he said, and if we do what we have to do. The flights that came in last week, I saw very good reviews, how persons were well attended to when they came in, and they felt, you know, that Grenada was on the right track. And I'm sure between then and now, persons might have even improved, because, you know, you have to kind of test it to see where your weaknesses are and strengthen. And I know the minister and his team, and we have a multi-sectoral committee working on it, involving all of key stakeholders, health, police, immigration, tourism, and so on. And I know they're doing a fantastic job, and I want to express compliments to them. But it is very troubling, because as we open, people are saying, don't open, don't bring people in. But I think, and I want to be honest, the problems we've had and the problems other countries have had are more with locals than with foreign visitors coming in. That is a reality. And for obvious reasons. The locals know where to go. They know where the lime is. They know, you know, if they rent a vehicle, where to go, or a friend pick them up. The tourists do not have that. And I'm not saying that in defense of them, but it is indeed a reality. And what we've been aggressively working on, the tourism bubble, it still has its weaknesses, but we're working so that certain hotel accommodations, based on the amenities that they have, will be able to accommodate certain things and to allow persons to do certain things, like maybe swim in the pool if it is scheduled properly, and so on. Whereas in a home with family or so on, and you know, one would think that people would be very, very careful not to bring any disease to their families. But I think people forget that the few short-lived minutes or hours with the family, breaking quarantine is not worth it because of the high risk. So I want to join with my colleagues to say that if persons do what they have to do, it will be really minimized. And we're not just saying that because we want to blame anybody, but because of the facts. When you look at what has happened in the hotel sector in Jamaica, when you look at what has happened in St. Lucia and other islands, the problem does not emanate from within the visitors who are coming to our shows within their communities, but with our locals. And if we love our countries, our country, we ought to do better. There is a need to open up. We have done well, and we have to look at the economy, how it's going to roll. We have to look at the amount of persons who are displaced from their jobs and need something to do, even as we balance the health and safety of our people. And if we do have an outbreak, we all know what the next step would be. It would be go back to lockdown again. So other countries that open up long before us, 2 months before us or so, some have done well, some have not. And we have to look at the best practices, what has been, and I know the Ministry of Health has been looking. We have been speaking to our colleagues in the other islands, and it is a learning process, and we're continuing to do just that. So I just want to appeal to our Grenadian brothers and sisters. Let us do. We know what to do. Let us do it. There are still too many breaches of the protocols, and now we have seen what we have seen. People would understand why we had to keep insisting, let us follow the protocols. I just wanted to go briefly again to a hot topic that I stirred up last week. I think it is necessary to make some clarifications. First of all, I respect the the responses that we got. I know Grenadians are concerned about Grenada, and we expect from time to time they may agree or not agree with us or with the minister, and sometimes they might be very correct in what they say, and sometimes it may be that because they didn't hear well or didn't understand. So I think I need to clarify some things and to say thanks to all of those who gave feedback, because we would certainly take those into consideration as we move forward. I will just seek to clarify based on the statement that was made yesterday, primarily to clarify any issues. First of all, that we're speaking to two cruise ships. Well, one is a yacht, one is primarily cruising, and we have been in negotiations with them. So nothing has been finalized. I want to emphasize that. And maybe if in my enthusiasm I gave the impression that we had an arrangement and we had given over beaches or we were renting out beaches, I want to clarify that this is not so. We have not finalized anything, and we were given permission by our cabinet to negotiate, and that is where we are at this time. So one of them, which is the Sea Dream Yacht Club, they will start from Barbados. So the guests would be coming from different parts of the world and going into Barbados. They would first have to comply with the protocols of Barbados. Do they have their negative test 72 hours before boarding the plane and so on? And before embarking on the ship itself, they will be tested again, and they had said that they'll be doing one more testing, but they'll be strictly monitored. So in terms of seeking to ensure safety, those protocols will be observed. So the yacht will come from Barbados. It will go to St. Vincent and the Grenadines. I'm not sure if it's going to the mainland, but certainly it has an arrangement with St. Vincent to do the Grenadines, and it will be coming, it is proposed to come to Grenada. The yacht capacity would be between 50 and 112. Small, perhaps a manageable group if we do what we have to do. So I did mention about beaches and exclusive, and maybe the word exclusive was a little bit strong, but what I wanted to convey was beaches that were not heavily frequented, because you don't want crowds, you don't want mass gatherings in Grenada, whether it's with visitors coming in. We are avoiding that, and so whatever arrangement we have with any groups coming in should follow that very same pattern, that the groups must be manageable and all of that. So there are discussions in terms of how it's going to be done. where they're going to be used. The yacht wants to come in and visit some sites, prearranged, booked, so that some tour operators will get something. We're working out the modality. How can we get vendors to sell in a safe way? And we're counting on my brother here to assist us in that as well. But tourism is doing its part to see how we can do it so that they can start earning something. But we're moving very cautiously. And while we have trained vendors already, we expect they will need some more training again, refreshers, and some more things would have to be put in place. So this is what we are working on. And the other one, which is the seaborne cruise ship, that one, they have asked to come in. They'll anchor outside, and the smaller the motorboats, smaller boats, they have a particular name, but that always, well, it's tenders, but it's a specific type. But the smaller tenders will take them somewhere to a spot, an agreed to spot, and they will organize some activities from there. They will keep them localized so that they're not circulating in our communities. The modalities are being discussed, so I don't want to go into details at this time. Once some arrangement is made, then or arrived at, not signed or anything, we will come back to our Grenadian people to let them know what we have proposed. So these are the two main things. In the second one, with the seaborne, we have 5 other islands participating. So that would be St. Kitts and Nevis, St. Lucia, Dominica, Barbados, and St. Vincent and the Grenadines. So we are working together to make this happen. We are still in discussions. There is no sinister motive to deprive Grenadians of their beaches. We are well aware how our people love to use their beaches, and I'm happy to see that. So I just wanted to assure the listening public that whatever decisions are made will be carefully discussed, carefully arrived at, and we will look at the area or the pathway of minimal risk or no risk to our people. And we're still in discussions. One is planning to come sometime in November and one in December. So hopefully before that, we will have arrived at some kind of understanding that is satisfactory to both sides. The other thing I wanted to mention, there is a situation with British Airways. And persons, thank you, if I may have a little water. British Airways, that happened very recently, that British Airways was all booked to come, had a pretty good load, and then based on the size of the plane, you have to have certain materials so that if there's a fire, in case of a fire, you have to have enough foam to hold the fire and dry chemicals, which they call aggregates. The airport had some of that in storage, and when they tested it recently, they realized that it was not satisfactory. Maybe in storage it had deteriorated to some extent and could not be used, and so they had to inform British Airways. So there has been a downgrading, but the downgrading is airport did it themselves, recognizing that they didn't have all of the substance with which to out any unforeseen fire or so. Then they thought it best to postpone the coming of the flights for the next 2 flights. The material was purchased, paid for about 2 months ago, and it is on its way. We expect it to arrive on the 22nd of this month. So subsequent to that, we'll be able to entertain any British Airways flights. And one may ask why British Airways is the size of the plane. The other airlines from Canada, Air Canada, and JetBlues and so on, the American airlines can still come in, and certainly our Caribbean planes that fly the inter-Caribbean route can come too, but it has impacted British Airways. And, you know, I say that with concern for a number of Grenadians and visitors who intended to come. We've been have been receiving calls all morning. I don't think there is much we can do at this point in time to hasten it because it's already been paid for and on its way. But it is very, very unfortunate at a time when we're seeking to restore flights, restore business, bring back our citizens who have been maybe stranded for a while or whose time is up and they're ready to come back. We apologize. We are really sorry that this has to happen. And we are already talking about ways to ensure that this does not happen again. So we're working on that, and some of them are looking to come in via Barbados, via St. Lucia, because in any case, the BA flight stops in St. Lucia. But we're looking to see how we can assist them in any way to overcome some of the hurdles. But we know a number of persons will be inconvenienced, and we just beg their patience for this short time. So I wanted to also mention that it is not because of any structural problem or otherwise, but you must have the supplies and they must test adequately, and that is where they found that we didn't have, the material wasn't up to what it's supposed to be, up to the standard, and so we have to now dump that, and we are waiting on the rest of it. So this is where we are for the moment. Thank you.
Thank you very much for that update, Minister Modeste Cohen, and to you as well, Minister Steele. Members of the media, the floor is now open to questions. I note that Callistra Faria has indicated that she has questions. So, Callistra, you may get the ball rolling this morning. Callistra, you may proceed with your questions.
Thanks. You hearing me now? I was having trouble unmuting myself.
Yes, I can hear you. You may proceed with your questions. 3 maximum,
Okay,
and then we take a second round, okay?
Good morning, Dr. Modeste. Can you say specifically that Grandans Beach, I know you have a list of beaches that you're considering. Can you say specifically whether or not Grandans Beach has been removed from that list, given what Grandans Beach is? It's one of the most widely used beaches by Grenadians. So is it still on the list? Are you still considering that beach?
Well,
First question.
Yes, and in response to that, I did say previously that there is a task force looking at it. I am not aware that Grandans Beach was on it. So I think it is best to let them deliberate on it and do the negotiations, and we will come back to the Grenadian people, but I don't know that Grandans Beach was on it. So let us put a little bit of confidence in the task force, and they've been hearing the complaints, the concerns, the good suggestions that were made, and that is what they're looking at now. So let us just await the outcome of their deliberations. Thank you.
Okay, I asked because last week you said that the cruise ship Seaborn had requested Grandans Beach, and given the fact that we are in a position where we really need to reopen our tourism industry, that's why I wondered whether or not we were still considering their request for Grandans Beach. My next question, Minister of Health, good morning. The breach of protocol, I wondered, there's a voice note circulating, it has not been authenticated, of course, claiming that the health officials had allowed the gentleman to leave quarantine because it was day 4. Apart from that voice note, are we properly explaining to people that a negative test on day 1 does not automatically mean, are people understanding, and are we taking great pains, both at the facilities and wherever else, to explain to people that you can't leave until that test, the fourth day test is received, and that you are cleared at that point? Are we having misunderstandings and ambiguities there? Also, would you consider extending the quarantine period, particularly for Grenadians who are coming into the community? Is that even possible? Given that Dr. Charles said yesterday that the gentleman's sample was taken on day 4, on the morning of the day that he left quarantine, we have a 24 to 48 hour turnover period for test results, which has me a bit confused. If your 4th day test is what determines whether you go home or not, why are we taking samples on day 4 when we won't get the sample for at least a day or 2?
Yeah, let me clarify for you, Callistra. The individuals are to remain in quarantine for a minimum of 4 days. They will be tested on day 4. It clearly says, they are clearly told, and they sign to that they must await clearance, results and clearance, and that the results take 1 to 2 days. So if results can be, if somebody is tested in the morning of day 4 and possibly get the results to the lab, and that they can get back the results by the end of day 4, then and it's negative, they would be given clearance. But you were in quarantine not until you were swabbed. You were in quarantine until you were told you are clear to leave quarantine. The individual clearly understood that. The individual believed, because he had a negative test on coming to Grenada, and the individual told us that he is tested regularly in Canada, and therefore, as far as he was concerned, he didn't have it, and he did not wait for us to tell him that he didn't have it. He assumed on his own, and he took actions inappropriately because he believed one thing. In fact, up until the 2nd test on Sunday, he was still in disbelief, although we had him from Saturday at our site. We removed him from where he was and we put him into our site where we had the appropriate security, additional security, because we now see him as a flight risk, so to speak, from quarantine. He was still in disbelief until Sunday when we got the 2nd test. So it speaks to the individual. The reason that the test is done on day 4 is based on the science of exposure, and this is a prime example of showing that it works. The science works, telling people that they must stay isolated from us for 4 days before they are tested, and for us to determine, when we get those test results back, whether they are cleared to enter society with the rest of us. Extending the quarantine period would not be the solution. If people are, or some people are breaching quarantine, and if the science says that we can pick up safely at day 4, whether they are infectious or not, having them stay in quarantine for another 7 days or another 2 days or so before we test them, is just going to create more opportunities for them to breach the quarantine. We have used the science to determine that on arrival, if we keep you 4 days and then test you, not before. Now, the people who are tested before are those who are going into home quarantine. They're tested before and still at day 4, simply because we're sending individuals to their own home, and our method of surveillance is a little more stretched there. So we take the added precaution of the additional test on arrival and then a test at day 4. But it's mandatory. Anyone coming in, they must be tested at day 4, and they cannot interact with the rest of Grenada society until receiving clearance after day 4.
Thank you very much, Minister. Mikey Hutchinson, you're next. Mikey, you may proceed with your questions.
Okay, good morning again. I had difficulties unmuting myself. So my question is along the line of Calistra's point as to whether or not there's likely to be any ambiguity as to when you are free to leave. Is there something like a sign-off process, Mr. Minister? Like at the end of that day, you sign, like when you're discharged from hospital?
There is. You're communicated to by the health officials to say that you can leave quarantine. And in fact, the hotel or the facility is also communicated to say that X guest is free to leave. So the hotel can make the appropriate arrangements as well, but not until then. If someone tests positive, or if we think there is additional risk or so, the individual will be kept longer. So it clearly says a minimum of 4 days. You must make appropriate arrangements for at least 4 days. We are now saying 5 days. Just because some people were saying because you said 4, it has to be 4. No. It is, you are going to be tested then, and based on your test results, when those test results come back. I want to just reiterate that some people seem to believe, or this individual seems to want to use as his excuse that because he was swabbed, then he could leave. And another individual who was, I'm told, charged yesterday was of the same belief. As far as they're concerned, they were swabbed, not taking into the reality or the common sense that you have to get results back. Not recognizing as well from the very countries that they come from, they can't get results back sometimes for more than 7 days, and they have to wait. So it was a complaint from some of the individuals who were looking to return to Grenada that it was taking so long to get test results in the United States. Little Grenada has endeavored to get test results back within 48 hours, and we are doing so. But I think it is the same way they will have to do it in the US, wait for the test results. It is reasonable to expect individuals to know that you have to wait for your test results. When you go to the doctor, you go to the hospital to give test results on anything else, if you think you have any disease or anything else. It's not simply when you go give the sample of blood or stool or saliva or urine that you're cleared. No, you wait for the test results. So any attempts by individuals to imply that once they're swabbed, that they believed that they were free to go, I think we as a people have to tell them, look, stop trying that. Stop trying that. Anywhere else in the world, and for any other test, you have to wait for the results.
Do you have additional questions, Mikey?
I do. The unmuting process is really slow. I'm sorry. No, I've heard the minister use the word charged when referring to persons who are breached. I need to understand clearly, when you say charge, is it like when there's a criminal charge against somebody, then you have to go to court and then there's a sentencing, or when you're charged, it's like it's a fine that you need to immediately pay?
It's a criminal charge. It's a $10,000. So the legal process has it, or the law has its process there. But they are charged, yes, and it's a $10,000 charge. And based on that amount, it makes it a serious charge and does involve our court systems.
Anything further from you, Mikey?
Okay, I will pass the floor on to somebody else until the next one.
Okay, Nancy McGuire from Grenadian Voice, you're next.
Good morning.
Good
I'm
morning.
wondering of the 13 and 17 people, indirect or direct, that you've put in isolation, how many of those were people from the flight, and how many are people from the community where this person had gone to? Thank you.
The individuals that the 13 and 14 are from this person breaching quarantine. there are other individuals who are out of precaution are being told, who are on the flight, who are being told, because they would have already, remember, these individuals who were on that flight would have already received a negative PCR test result 4 days after arrival. So we are observing those individuals and notifying them that they were on a flight with someone who did test positive, and therefore they should take additional precautions. But on the flight, individuals were carrying out the proper safety measures of wearing the mask, proper protocols as best as possible, and then they did quarantine for 4 days and were tested. The 13 and 17 individuals since Saturday or on Saturday were exposed to this person, and they are being held in isolation for 4 days, and then they will be tested. So we're following the same science there.
Nancy.
Thank you. I have another question.
Sure, Nancy, go ahead.
Locals returning home that figure they can get away with not staying or going to an approved place and want to go to their family homes. You had mentioned how overwhelming it was for officials to deal with these people, and you're looking at how to combat that. What are you going to do about that to try and stop it before it happens in the future? And secondly, the security improvements at these places where people are sent, is that going to involve more personnel, more training? How are you going to address that? Thank you, Minister.
Yeah, Nancy, yes, thank you for that question. Yes, we have to assume that there will be other individuals like this person or like these persons who have breached quarantine, and therefore, yes, extra measures have to be taken. We're looking and today to confirm additional use of geolocators, so not just for persons who are in home quarantine, but persons who are in smaller facilities as well, and also requiring the facilities to have more personnel there for security. What I want to say with that, though, that we need to be aware of, and those who may be looking to come in and are the compliant ones, is that's going to come at an additional cost. It's going to come at an additional cost to the individuals who are looking to come to Grenada. And that's because some have been non-compliant, and therefore, as you have rightfully put it, we need to take extra measures to protect the rest of us.
Nancy, will that be all from you this morning?
Well, can you just elaborate a little bit more on the improved security at these locations? Thank you.
Sure, Nancy. As the CMO sort of implied, but yes, let me be a little clearer. Some of the sites may be delisted because they just cannot meet the criteria. Additional security personnel and measures to make sure that there's 24-hour observance. Now, there have been some sites that have been doing that and has been appropriate. That's why we caught the individuals on Friday night who were attempting to breach quarantine. Geolocating watches is another, but that's an additional on top the board $25 charge to the individual. So they will have to pay for it if they're going to smaller sites or would like to go to smaller sites. Those are some of the measures, as well as the ministry took on additional personnel, contact tracers, from Thursday in collaboration with the Ministry of Tourism, who will be more eyes and ears for us to monitor these sites. We probably will have to consider taking on more individuals to do the monitoring, to make sure that there's compliance across the board, compliance by those who are in quarantine and compliance by the sites who have been approved.
Thank you very much, Minister Steele. Rena, the floor is now yours. You may proceed with your questions. Rena Pear, GBN.
First off, let me just say I came in a bit late, so if I ask a question that that must have answered before the information was given. Please forgive me. Minister, could you tell me, have we given consideration as it relates to removing some of the sites listed as mandatory quarantine following these instances of lapse in security? There is a concern that some of the hotels listed in GTA's home staycation program are also listed as quarantine sites. Is this so? Um, as it relates to the
Rena,
as it
can I
relates
just
to
interject here
the
before
contact tracing,
Rena? Can
could you
I interject
confirm
here
to
before you
me
proceed?
if one of the schools in St. Patrick's, St. Patrick's Anglican School, was affected by the person leaving the quarantine site?
Okay, Rena, with respect to your first questions, I think the minister, just before you asked your question, he spoke to the possibility of delisting some of these approved facilities. So that has already been answered. Minister, I think you may proceed with the
If I
second
may, I
question.
just wanted to say that we sent letters out to all of those sites that were approved. By now they should all have it, warning them that of our concerns and that this was under serious consideration.
Yeah,
Thank you very much.
Rena, yeah, thank you. I've gone further and spoken. I think the minister did speak to some of the owners of the sites, and I did as well. And I have seen on social media some of those sites announcing to the public that they would no longer be able to carry on certain activities that they were in the past because they are quarantine sites. So we are seeing a level of compliance, but like anything else, we will make sure through the public health officers, public and environmental health wardens, and the Royal Grenada Police Force that there is compliance. Your other question with respect to the schools, the ministry has not requested any school to close. However, I will say that based on the protocols and the training that Ministry of Education, Ministry of Health has rolled out to the various schools, some principals do have the discretion to close if they think there is a risk. Whether that risk is validated or not, I would not blame any principal if they felt so. Maybe it was from calls from parents who were expressing concerns or so. But from a ministry standpoint, no instructions or no request was made for the closure of any school. I would say that some of the individuals who are in quarantine, some of the 17, are students, simply because they are family members of exposed persons, and those individuals have been asked to stay home. So that may be where there is the mix-up, so to speak.
Minister didn't answer about some of the listing, the hotel listing, being part of the staycation promotion. People are showing concerns that these hotels are also stated as quarantine sites.
No, I thought I did, and Minister Modeste as well. These sites have been instructed to choose. They cannot be both. Now, there are one or two hotels based on how their buildings are laid out, etc., and their level of security that possibly can do both. One wing on a different side of the property being for quarantine and another wing for homestay, and different restaurants or so, or different times, or the wing for quarantine is purely room service. If that and where that is possible, then yes, that would be contemplated, provided the appropriate measures of surveillance and security are there. But in general, Rena, most of our smaller facilities will not be allowed to do both. They will have to choose whether they want to be a quarantine site or a homestay site.
Thank you very much, Minister, and Rena, to you too for your questions. Linda Straker, you may proceed with your questions. Linda Straker, you're up next.
Yeah. Hello?
Yes, good morning to you, Linda. You may proceed.
Right. Just like my other colleagues, seems like I do have a little bit of issue unmuting myself. Good morning to you, Philo, and our ministers. My question is more or less one of clarity. And the Minister for Health mentioned that a person would have claimed that he was regularly tested. Reading up, and my understanding is very few people who will be regularly tested. Is the minister in a position to tell us what is the occupation of the person for that person to be regularly tested? My second question is, um, looking at social media, there is concerns coming from some people, and I've asked the question at different times, whether or not there is a system in place for us to validate that the PCR tests that these people are walking with are authentic. Is there such a system in place to confirm that these people are not walking or displaying questionable, fake PCR test results? And the third question for now, one of the things I listened to the radio this morning, a lot of people are saying, oh, our legislation have no teeth. And with regard to charging these persons. Um, in October, not October, in a couple of weeks ago, we would have had the presentation or the submission to Parliament of the COVID-19 bill. Can the ministers tell us whether or not this bill is still under consideration in terms of containing and controlling COVID in the island?
Okay, Linda, thank you for those questions. With respect to the individual, what I had said and still what we hold to is that the individual said that based on the job they have, they are regularly tested in Canada. Now, I know certain jobs, not just in healthcare or high risk. Certain jobs, there would be a policy. So in construction, in certain countries, or maintenance, etc., where individuals are interacting by virtue of the job in close proximity with other individuals. But that is his comment to us, and that was his rationale for his belief that he was not positive. That is not taken into consideration for us. As far as we're concerned, he must have a test, regardless of how many tests he had before. He must have one not older than 7 days before his date of travel. Then, upon verification of the test here, all individuals must, on landing, present the copy of their test results for us to verify. And then they're still, regardless of whether it's a gold-plated test result or not, they go into 4 days of quarantine and then are swabbed and tested by our labs here in Grenada before we give them clearance to enter the rest of our community. So in terms of validation of the PCR test that people come in with, we validate based on it being one, an RT-PCR test from a recognized or certified laboratory from the country that they're coming from. This is done as best as possible. We recognize that states have the authority to certify, and that is reciprocal in the same way that countries recognize the government certified laboratories here in Grenada, which is the General Hospital and St. George's University, to do the PCR test. We recognize where it is a state certified entity that they've gotten their test results back from, but still keep them into the quarantine and do our own tests as well. There are instances where we have queried that on individuals landing, and those individuals are immediately swabbed there and tested, as well as still going into the 4-day quarantine. If there are any occurrences where we see somebody purposely try to present a false document, it's the same for immigration or customs. They will be charged accordingly there. With respect to the regulations, as you are aware, based on the public response, mainly from the opposition as well, or opponents, the bill, there was a request for the bill to go into consultation. That bill has gone into consultation. I await feedback from that consultative process. In the interim, we have had to pass certain amendments to existing bills in order to give us, as the public rightfully says, the teeth to enforce the quarantine and public health acts and protect our citizens from COVID-19.
Thank you very much, Minister. Mikey, I know you had some follow-up questions, but I just want to take two questions from online before we make the second round of journalists. Minister, there's a query here regarding persons being held accountable. So the person who actually breached quarantine has been charged. Is there any accountability placed on persons who support them? For example, with other charges, you may have aiding and abetting. So family members who assist them in executing that breach, is there any area of the law that speaks to them as well?
Yes, based as far as I'm aware, the Quarantine Act allows us to charge an individual, the individual, as well as anyone who assists the individual.
Okay. And also there is a question here for greater clarity on the new protocols as it relates to the Caricom bubble. Can you shed some more light? I know there was some change announced just recently.
I was part of the original discussion or present at the meeting where the original decision was made to create a Caricom bubble, which would have been Barbados, Dominica, St. Lucia, St. Vincent, and Grenada, and St. Kitts and Nevis, to allow individuals to travel once they have been in any of those countries for more than 14 days and have been negative, to travel freely without the need for a PCR test. There has been a certain amount of uneasiness with this from the beginning, and certain countries did not put it into practice. And also there has not been a common policy or procedure for persons coming from outside of the bubble as well. So I would say that is the rationale, in my opinion, as to why Caricom has now moved to the point of saying that everyone will require a PCR test on entering any of the Caricom countries. There will be a different treatment with respect to green zone or Caricom. So in other words, all Caricom countries that are in a green zone based on their figures will be treated the same way. That is a negative PCR test, screening at the airport, and then allowed to leave. But there are some Caricom countries that are yellow and red zone and are treated accordingly. Simply put, there's now no differentiation between a Caricom and a non-Caricom country. It is just based on the level of community spread that you have in your country.
Thank you, Minister, for addressing those questions. Mikey Hutchinson?
Yes, it's the same question I was about to ask regarding the travel bubble and the recent changes. So that has been answered. But the minister said something that piqued my interest with regards to the charging of persons who breach protocol or who puts the nation at risk. And one would ask ourselves the question as to whether or not the charges fits the crime. Because here we are, somebody's putting an entire economy at risk, the entire country at risk. $10,000 as a charge, that's not necessarily what that person will be fined if and when sentenced, because pleading guilty, of course, automatically qualifies you for a reduction in that charge. So my question is really and truly, do we believe that, are we confident that that $10,000 is deterring enough for persons who wants or who might be thinking about breaching quarantine?
Well, Mikey, from the hat I wear as health minister, I'd like to see the charge as severe as possible, because the charge is in effect a deterrent, and it's also a penalty for those who breached it. So I would welcome that, but there's consultation going on at present. Also, we have to look at such a charge comes when you're up at that level, comes with the possibility of jail time as well, particularly if the individual has not been able to meet the expense or so of the charge. Simply put, I would welcome stricter legislation. I was part of this government initiative to pass a COVID bill, which other members of our community said no to. I do remember the leader of the opposition saying that we have no COVID in Grenada, so why is the government contemplating this? I do hope that she understands now why we were contemplating this, as many of us do as well, why we were contemplating this, as to whether there were certain aspects of it that people were uneasy with. That I have no issue with, and it has gone out to consultation. But the general statement of saying that we have no COVID in Grenada, so why are we looking to pass legislation for enforcement of some of the regulations? I think right now those who may have said that will understand the logic that we were pursuing at that point and continue to pursue.
Thank you, Minister. Linda, our final question this morning will come from you.
Good morning again. Can the Minister for Health provide us an update on the situation with dengue? We know that it has been increasing over the past few weeks. Can you tell us now how much persons has been confirmed to have been diagnosed with dengue? And for the Minister for Tourism, can you tell us the number of rooms that are presently allocated for quarantine purposes, as well as a number of rooms allocated for regular visitor entrance, and in total the amount of rooms that has been approved under the protocol for use, for occupancy? And my final question is, CAFA has a stamp of approval for hotels who would have been in compliance with its regulations to commence operation. I learned of that last week during a session with CAFA. Can either the Minister for Health or the Minister for Tourism tell us how much hotels in Grenada would have had that CAFA stamp of approval? Thank you very much.
Yeah, Linda, thank you for I'll take the two questions, the first and the last. But before I do that, just let me clarify or correct a statement I made. It wasn't the leader of the opposition, it was the leader of a political party here in Grenada. So please, my member in the House, the Honorable Tobias, it was not you. It was a member of a political party, a leader of a political party. Dengue, Linda, we have 37 cases. If memory serves me right, I looked at it yesterday, 37 cases of dengue. That's not the current active, but that's the total that we've had in the last month and a half. These samples are sent to CAFA for verification and testing. We do have 2 cases of type 3, had 2 cases of type 3, based on what I've seen, which is the hemorrhagic type. Those individuals, based on the timeline, I would think would have been cleared already. We have stepped up significantly, to the best of our abilities, the fogging, which is something that people request, but you will also see, based on the ministry's Facebook page and communications, public communications, we've stepped up the public awareness as well. I have said at the last press conference I was at, and at any opportunity I get for any public appearance on radio or television, that we need to tackle dengue the same way we have tackled COVID. We're all in this together. We would not have been successful or as successful as we have been with COVID if the public simply relied on the government to sanitize all public areas and sanitize the streets and neighborhoods. We had to all participate collectively, wear our masks, maintain the social distancing, and following the protocols relevant to this disease called COVID and how it is spread. Similarly with dengue, we need to do the same thing. We need to follow the protocols that are relevant to this disease and how it is spread, which is the breeding of the mosquitoes. The mosquitoes are not only breeding in government sites or on public roads, the mosquitoes are breeding in our very own households. And we need to take the necessary measures to stop that, and also to take the measures to protect ourselves when we are out, using insect repellent to prevent us from being bitten by the mosquitoes. With respect to CAFA, I'd say, Linda, that we are CAFA. While CAFA is seen as an independent entity that we send our test results to for verification, we are the ones that have set that standard with CAFA. So the Ministry of Health right now is following the CAFA protocols, and in the Ministry of Health, working with the Ministry of Tourism to certify facilities, it is following those CAFA guidelines. We do not have the ability, because of the nature of this disease and the location of CARFA headquarters being in Trinidad, to have CARFA come and inspect. But we are following those protocols, and in the same way that our lab is certified by CARFA to test for COVID, our ministry also follows the CARFA guidelines. We're not going to put the CARFA seal on, but the Ministry of Health is the one that is approving, following the CARFA protocols.
Okay. So, if I may, Madam Press Secretary, I just wanted to answer Ms. Stricker concerning the question about how many rooms and how they are divided. I must say that initially, in consultation with the Ministry of Health, we came up with protocols that a basic standard that all accommodation facilities should have. And so the inspection was based primarily on this. Certain things that you had to have, a number of things like marking out the spaces, having the hand sanitizers in proper locations, and all of that. And one of the things we insisted on was that the staff were supposed to be trained, and we did conduct, in collaboration with GHT, a number of training sessions. As persons started to come in, and with recent events that would have taken place, and even before that, we preempted, and in discussion with the Minister of Health and his team, we decided that some facilities were crossing the lines in terms of what we thought was a sort of breach of the protocols, and certain activities lend themselves to that. So recently we've started to, we spoke about a corridor for the hotel accommodation, and that corridor includes just the facilities with the amenities, different things, sometimes structurally, how they can keep individuals separate. Some facilities, and I don't want to call name, I don't want to appear to be, recommending one above the other, but some facilities, for example, have more than one restaurant, so that the clients can book into restaurants before the meal time, and they know what is the maximum and all of these things, and so they can cater more adequately for their guests. So now we've come up with a differentiation, and it took us a while to get there in terms of who can fit into that corridor or that bubble, which facility, not the individual, but the facility can do, and which facilities cannot. And we have agreed at this point in time to look at 3 different levels of facilities. Those that can have this, well, it's a criteria. You have to have your security, full-time 24/7, and the structure that will allow you to do certain things, be able to provide meals for persons who are confined into their rooms, or be able to provide the adequate spacing for, whether it's for meals, whether it's to use the pool or whatever, that some others cannot do. So that is the first type of separation that we've done. The other ones are the still big intermediate rooms who can do certain things, and the smaller facilities who will not be able to do that, that we said should be limited to only quarantine services. So the GTA is in the process of separating that. The list that we have on our website, we are in the process of doing that. We've talked about delisting, removing persons from that list based on their persistence in non-compliance and so on, because we think we've given everybody a chance. Minister and I have spoken to persons, and we have written. So we're in the process of doing that, and perhaps we can share that soon, because you will see it reflected in our website. There are probably just about 7 who can really fit into that corridor that we spoke about, but the rest will have to go to intermediate, where certain privileges cannot be given, because it could easily be taken advantage of or whatever. So it's a very, very good question. We're still working on it, And within the next week or so, we should be able to give you the exact facilities which fit into whatever category. First of all, we must tell them, so we're in the process of doing that.
Thank you very much, Minister. Rena Pear, so you got lucky this morning. You can have the final question before we actually wrap up here. Rena, you may proceed.
I just wanted to ask final question to Minister. Would you or any part of the Ministry of Health be disclosing the events or the social events in which patient 25 went to? I know that you have been asking, or Dr. Charles were asking yesterday for persons who had any interaction with the guy to come forward. So would you be disclosing any of the events that he attended so persons can come forward?
At this point, the contact tracers within the communities have been communicating there as to where this person was based on the information that we have and the information from others that we have communicated to. So he said he went to a shop, we communicated to the shop, and the shop told us who was there, etc. In terms of the other, if there were other events, I too have heard an audio going around on social media talking about there being a fete or so. That is being investigated or followed up. But let me say, simply put, the Ministry of Health and the Royal Grenada Police Force are not aware of any approved fete on that night in that area. This just goes again to show what we have been asking. Gatherings above 20, we have been approving for those where possible, and we are asking the community for this very same reason. If individuals did have some sort of fete that night that this person possibly went to, if we had known about it before and made sure that it was being conducted with the appropriate protocols and procedures, then we would know immediately to follow up on it, and we would know immediately that persons would not have been put at excessive risk, but know how to follow up, because a record would have been kept of everybody who entered, and it would have made the job much easier. I think what is the problem now that you need to ask is, if there was a fete, the individual who had it or promoted it was doing so against the regulations, and therefore may have some difficulty in coming forward to us to say, I did have something there and there's a possibility that this person was there. And this is what we've been begging people not to do. And it's a primary example of it. There has been, and I recognize and support the outcry by the Grenadian public for this individual's recklessness in breaching the protocol and putting us all at risk. But similarly, the outcry comes from those who put us at further risk as well in that third level of defense that I spoke about, in terms of following the protocols and procedures. Our bus drivers, bus owners, in terms of wearing the mask. We have police said on yesterday that they are out charging individuals for non-compliance who are transporting our citizens around this nation. We have individuals on social media telling us that they fear that there was a fete that this person went to, but not taking issue with the fact that somebody had a fete, possibly without permission and total non-compliance. So that as far as everybody was concerned, the sayings I was hearing before, we don't have COVID here, what the minister getting on so for, why you don't allow us to do we thing? And we have said consistently that it is because of the possibility of this. This individual came home for a funeral. He came home for a funeral to bury a family member on Tuesday coming. Other individuals who have come home for funerals out of the necessity there to bid farewell to loved ones. So we cannot just simply keep our borders closed and not allow our citizens to come home. So we've put mechanisms in place for them to be in quarantine, recognizing that if they are coming to spend time with loved ones, they would care for loved ones and the country that they love and not put it at risk. The beautiful Grenada that they were complaining and cursing the government for denying them to visit over the last couple of months is still the same beautiful Grenada that they are now putting in risk at risk. So if we all follow the regulations, we all will not be at risk. If we breach the regulations, then we are putting ourselves at risk. So I am calling upon members of the public, especially the individual who has thankfully circulated the possibility that there was a FET in the area and the person went to. So that allows us to try and follow up on that. But to also ask the promoter of the FET, if there was a FET, why did he have a FET when the regulations say no, without the permission of the Ministry of Health and the police? So we need to look inwards as well. The ministry and I have clearly said numerous times, sitting right here, that we always have to take into consideration the possibility that the first and second lines of defense will not, it's not a perfect thing, that somebody would get through. I have said here that there's a possibility that when the person gets through, they may go to a mass gathering function also. And this is what individuals are now telling us possibly happen. Please, let us all take into consideration COVID-19 is not going away. The borders cannot be closed. We have to find a method of maintaining our livelihoods as well. And therefore, we have to take the necessary measures to protect ourselves and our nation. It cannot simply be that some of us out there want to say, well, just lock up everybody or don't let anybody come in so that we could do whatever we want. No. We all have to take on a certain responsibility in this. And it's simple. Wear your mask, maintain social distancing, and avoid mass gatherings. And where we make the effort to allow mass gatherings, make sure certain protocols are followed. The places that have been allowed to have parties and so, there's one specific rule. Everybody must sign in. You need to know the names of everybody that's there. And simply put, if this promoter had followed that, we could have gone there immediately and verified. And even if this person lied and didn't give their name, we would see the names of those who did, so we could contact them to let them know that they're at risk. But we're not in a position to do that, because not just this individual who breached protocol, but if somebody did have a party without the permission and following the protocols, they have also put us at risk. So we need to think this through, the whole thing. It is an interconnectivity.
Minister, that very much sounded like your closing statement. So I will turn over to our Tourism and Civil Aviation Minister to share her parting words this morning.
Thank you. I was just thinking that myself, that it was a parting statement for both of us. Very well put. I couldn't add much more, except to say that the protocols about the wearing mask and the distancing and so on, these have been tried and proven. Let us not experiment anymore. If it is proven, it is proven. Let us, all of us, commit ourselves to observing the protocols in every aspect of it, and we will see that we can keep our country safe. I believe we can keep our country safe and still get back some economic activity, and both are important. The health comes first, but the economic activity for people to go back to jobs is also important. Let's work on it, Grenada. Thanks.
Thank you very much, Honorable Tourism and Civil Aviation Minister, Honorable Clarice Modeste, and to our Health Minister, Honorable Nickolas Steele, for being with us here this morning. I think most importantly, we have to come away with the knowledge that this is a dual responsibility. Government plays its role via the various ministries and stakeholders, but we as citizens of this country, we also have an individual responsibility to do what is necessary to maintain the recommended protocols. So let us please do that. I am Press Secretary Philomena Robertson. Thank you so much for joining us this morning. We'll see you again next week.